Hey, today we're going to go over Incredible Years, the evidence-based parenting program out of the University of Washington. Today we're going to go over what it is and what it looks like. So the main piece for it is that Incredible Years was founded initially as an intervention for parents of children with oppositional defiance disorder and conduct disorders. And it quickly grew to recognize uh, general at-risk families, such as those in low socioeconomic statuses involved in Head Start, or families that are at risk for child abuse or neglect, which is where my experience personally is at. Um, the parenting classes tend to be between 10 to 16 participants, um, and their general goals are just to improve attachment uh, and parenting skills through both behavioral, cognitive, and social learning theories. Um, so, running through our little agenda here, um, the main part of our work today is the recruitment. And so, recruitment can come for this intervention through a variety of sources. It's really been targeted to hit different populations that need it. So there's school-based interventions, there's social work-based interventions, there's clinical interventions, there's church-based interventions. And so it can really vary based on where it's originally coming from. Referrals can come either formally through a therapist or other um, service provider, or they can also come from the secretary in the front all the way down to uh, a bus driver for the service. So really it's just about a word of mouth that goes around, as well as when one parent gets invited into the program, they're allowed to bring in a partner or any other one individual who's been a support for this person. So it's open in that way as a group. It actually also is closed based off of when the group initially kicks off. That main one of the couples, at least, is the anchor that's supposed to be in the intervention the whole way through. So that's a little bit of a close piece for it. One final clarification for it in terms of recruitment is that it is for children ages 0 to 12 is the target population in terms of who the parents are having in home, either as their oldest or as the child with a concern for their behaviors. So that's where we're going to kick it off right now. And then I'm going to go ahead and pass it over to how do we start this group. So the start of a group begins with the initial phone call that screens in whether the uh, parent is appropriate for services based off of the age of their child, their interest in the service to begin with, as well as any cognitive or emotional delays that might prevent the parent from appropriately benefiting from a group environment. We then go ahead and on the leader side of things, set up an appropriate location. It is community based, so it has to be someplace that's accessible. It also involves setting up interventions that could address barriers for the parent to be arriving. So Incredible Years is responsible for transportation for parents if they can't provide it for themselves. Likewise, childcare is actually a pretty big concern for success in parents, and so the provider is also responsible for setting up childcare. Goals of the group, I'm going to list them off here so I don't miss any of them. Several groups, several goals for this service. The main one is to improve the performance and outcomes for these children who are at risk, as well as to mitigate any kind of at-risk behaviors from the parents, are both evidence-based. So the main ones are increasing the child's social emotional language, empathy, problem-solving skills, on-task school behaviors, reading skills, academic competencies, as well as strengthening parents' bonding and attachment. They're skill-based for teaching child-directed play, developmental milestones, teaching parents skills such as label praise, positive communication, and positive coping skills. Probably my favorite thing about Incredible Years is the leader's role. is that it actually is, rather than that of an expert, that of an encourager. So it has a bit more of an active role than what we've seen in our traditional processing groups in class. It brings up certain topics and leads them forward to parents with open-ended questions on how they personally deal with these pieces. It's not a cookie cutter approach, so it really is about providing evidence-based skills and giving parents an opportunity to apply them to their own context and work through them in that way, as well as the leaders there to help facilitate any kind of practice that the parents might have for concerns. So that's if they don't feel like they can integrate a certain skill, the therapist is there to help guide them in a facilitated role play of the scenario using two different parents, one taking the role of the child. And overall, the attitude is that of a cheerleader, which I personally am a big fan of. One anticipated issue is addressed through the way the service is actually provided and its techniques. So the main focus of the program is to only do 15% skill teaching. That's the time spent discussing and teaching and modeling the skills themselves. 25% of the session is in video vignettes that have examples of the skills either being clearly used or parents in situations where it might come up. So the parents can then see outside of themselves what's going on, and those videos have different families from different racial backgrounds and different socioeconomic backgrounds, so it has some blend there. But the big part is that it spends 60% of each session is group discussion, group practice, and trying to integrate this information as it personally applies to the people attending. Group members are responsible for taking on their specific growth and how they're applying it to their kids. So we want them especially to be presenting their concerns, especially around safety, into the group. So that might be whether it's concerns for confidentiality in group, or if it's their concerns for what they're gaining in terms of skill experience outside. We want that being brought up in group. We have homework that gets assigned in journaling, and in that we provide opportunities for parents who aren't very open in terms of extroversion to be able to write out concerns so that leaders can follow up in a written format for those who can't speak very openly with. One final thing that I got for you today as I close is going to be an overview of what the outline of curriculum looks like. And so you'll just see that the first part, which is the 2/3 to the beginning, is all around positive pro-social interactions. And the final third of it is around corrective behaviors and how to handle misbehaviors, with the idea of positive piggy banks, investing a lot into the child so that when you make emotional withdrawals, there's stuff inside the piggy bank for the child to go along with. So hope you got to enjoy the presentation, and thank you for your time.
2, 1, go.
All right, so I just want to give a little example of what it might look like in a session. If I have a room full of other parents here, I might look at my co-leader and say, all right, so let's go ahead and get video 3 ready to go. All right, class, so today we're going to end up looking at a video of child-directed play, because that's our topic for today. What I'm going to have us look at is a mom and her daughter engaging in some block play. And I want you to see, one, what do you see mom doing that seems to be child-directed in her play? And two, how's the daughter reacting to this? So those are our 2 little pieces to be watching for today. And if you wouldn't mind, go ahead and getting our video started. We'll watch that and talk about it after this.